Well, late this past summer, there were fears by some of a so-called twin-demic, flu season arriving heavily on top of the COVID pandemic. So this week, we circled back with an infectious disease doctor at Spectrum Health 5.5 months later to see if his tempered optimism then is proving fruitful.
In August, when we spoke with Dr. Liam Sullivan of Spectrum Health, he was hopeful that more people would choose to get the influenza vaccine this season.
What I heard is that the percentage of people was higher this year than it has been in the past. So that was a good thing. We're happy to hear that.
So you can imagine his excitement of what appears to be a silver lining from COVID mitigation efforts on flu season.
It's dramatic what happened in the Southern Hemisphere.
Dr. Sullivan says a recent CDC report from the other side of the equator shows their flu season, which tailed off in October, saw a significant drop.
They looked at Australia, Chile, and South Africa, which do very active flu surveillance, and it was amazing the difference in the 2020 flu season compared to previous seasons.
Right now, smack dab in what is normally the peak of flu season here in the Northern Hemisphere, we appear to be on a similar track.
And normally from November until, sometime in April, you see this bell-shaped curve going up, and the percentage of positive tests for influenza usually is 25 to 30% by this time of year.
But instead, Dr. Sullivan says what we're seeing is nearly equivalent to what we see when the annual virus fades into summer.
Right now, the average test of week to week since the start of flu season has been 3% or under. That is unheard of. We're almost at the interseasonal levels right now of positive influenza tests.
And while there are still a couple of months to go before flu season is over, it's clear distancing, limited school, and increased focus on hand washing are all helping. But one method, according to Dr. Sullivan, may rise above the rest.
Masking probably has a gigantic effect on influenza, because in influenza, it's spread by droplets, and a mask will stop a droplet very quickly.
So much so that he says even when COVID goes away, don't be surprised if they stick around.
I would not at all be surprised, Derek, if some people going forward, like you said, during flu season, I think you're going to see more people wearing masks in public.
Yeah, makes sense. Dr. Sullivan says flu vaccines are still being distributed for a couple more months, so those numbers, as well as the overall influenza case and death numbers, should not be out probably till May or June. To track influenza here in the U.S., however, Dr. Sullivan recommends the CDC's Flu View. We have a link to it right now on our web store.